Welcome back. This segment is brought to you by Holland Hospital. Millions of people use them, but are vitamins and supplements really helpful? Dr. Christopher Howell from Lakeshore Health Partners is here now to talk with us about their effectiveness. Thanks for joining us.
Absolutely. Thank you for having me.
This is really a good time for this because a lot of, we're around the New Year's, okay, I'm not going to say resolutions, New Year's goals, and a lot of them obviously involve becoming more healthy. But it's tough to kind of know what exactly it is that you need in terms of vitamin. So where do you start? Like, how do you know what you need?
I think there's three important questions to ask when you look at your pill box and decide what vitamins am I going to put in there. The first one is, what is the evidence behind these vitamins? Is there strong evidence that this is truly beneficial for my symptoms right now? It's going to make me feel better. Benefits in terms of longevity. I'm going to live longer if I take this. I'm going to have less cancer. It's very difficult to get those answers, and oftentimes people just seek their family, their friends. I want to use these chocolates as a little example.
Yes, that is a wonderful bowl of much M&M goodness over there, sir.
Emphasize, despite the pleas of some of my patients, chocolates are not an essential vitamin or mineral.
It's vitamin CH.
So, I'll use these here, and for just an example, use vitamin C. Perhaps you've heard it's good for your heart.
Okay.
So you may ask your family, and maybe 4 members of your family here, the red chocolates, say, yeah, I think it's good for your heart. One family member's not so sure. Well, I need better evidence than that. Perhaps you've heard something on TV, new latest article. New study comes out, vitamin C potentially helpful for your heart. And take a look just at the top of my large bowl of chocolate here, and you look at this smaller study and say, well, on average, if you look at the top here, most people, the red chocolates here, say, oh, this is good for my heart. Again, you're starting to think this is a good idea. This happens very often in medicine, where initially we do small trials, we think something is potentially beneficial, but really until we start looking at a much larger population.
Oh, look at that, vitamin CH right there.
Suddenly, when we look at the whole population, when we do a very large, thousands and thousands of patients trial of a particular vitamin and supplement, oftentimes the case is it doesn't pan out. It doesn't work in the long term. And that's happened over the course of the past 10 years to many of the commonly used vitamins and supplements.
So if you want to start out and your goal is to get healthier, are you better off with using the vitamins individually, like, okay, I need vitamin E, vitamin C, maybe vitamin A, or are you better off just using a good multivitamin?
A good multivitamin is going to have everything that you need.
Okay.
For the most part, if you are eating a healthy, well-balanced diet, you are getting all the vitamins and nutrients that you need.
Okay, that's probably not an option for a lot of people.
In that case, I see no harm in a multivitamin.
Okay.
And that's an important sort of a second way to approach the vitamins and supplements that you may take is, well, perhaps there's not the evidence. Perhaps there's nothing out there, but how does it affect me? I want to take vitamin C. So you take vitamin C for a month and I feel a bit better. There's no harm in taking the vitamin C.
So you can't take too much, because that was my other question, because I would like the B vitamins for energy. I would like to take 5 bottles of B12 every day so
Sure.
I can, I
Sure,
can function.
absolutely.
But is there too much of certain things or no?
So vitamins come in 2 different types. Some are water soluble, meaning if you take too much vitamin B, it's just going to come out in your urine.
Okay.
I like to say it's just expensive urine.
Okay.
If you take too much of the fat-soluble vitamins, they can build up in your system. So vitamins D, vitamin A, vitamin K, vitamin E, these can all build up and potentially be toxic in very, very high amounts. These are generally prescription amounts rather than over-the-counter.
Now let's talk about supplements for a moment too, because I know there's so many, especially when it comes to health, nutrition, diet, things like that. There's a lot of supplements. Do they undergo the same testing as vitamins? I mean, are they things that, the FDA always has to approve, things like that? And how do you know what the guidelines are for supplement use?
So the FDA regulates prescription drugs, and they are very, very stringent standards before a drug can come to market. And the claims a drug can make are very tightly regulated. It has to be proven in a large study like this before it can do that.
Oh, okay.
Supplements are very different. Their standards are very different, and they're regulated in a completely different fashion. So a supplement may not need a gold standard large trial involving thousands of patients in order to make a claim of benefit for you.
All right, sounds good. Some very good things out there, some very good tips and recommendations. Well, you can also find more information this week on our website. It's at WZZM13.com under the Take 5 links. He's got an upcoming conference as well. Well, it's time to start looking ahead to summer. We're going to help you get ready to travel with a look at some of the latest fifth wheels that are on the market. Stick around, please.